Victoria, I think you are good to go. And I see your slides fine, so you're all set.
Great, thank you, Colleen. Again, good afternoon to everybody. Thanks for joining us for this session, where we will discuss best practices for childcare centers to minimize COVID-19 transmission in their centers. Colleen introduced us. I'd like to speak very briefly about the DISH team. We are a team, as Colleen mentioned, at the Department of Health's Communicable Disease Service. And we focus on training and education on communicable diseases in educational settings. So that is schools, childcares and daycares, and institutes of higher education. In this slide and in the next slide, I just want to mention the sources for the information that we'll be presenting here today. Colleen will drop the PDF version of the slide set in the chat if she hasn't already, so you'll have access to it on your own as well. But I want to mention that several of the slide titles are hyperlinked to the resources that we'll be using here today. So if you look at the PDF version of the slide set, you'll see many links in the text itself, but also in the titles of each slide. Whatever resource we're using on that particular slide will be linked to in the title of the slide. Most of the information that we're using here today comes from the Communicable Disease Services. That's the Department of Health's guidance document for childcare programs. You may be very familiar with this document. It was recently updated on February 8th, and those updates are reflected in today's webinar. It's a very helpful and comprehensive, it's a 14-page document, which really outlines most of the information that childcare providers and early childhood educators are going to want to keep in mind as regards COVID-19 in their centers. Aside from that document, we'll also be referring to information from the CDC's website. But like I said, all relevant links are provided in the PDF file. The one other thing that I wanted to say is that this presentation is current now in February of 2022. But our guidance documents are updated fairly frequently. So you'll want to check back at the Department of Health's website to look for updates in the coming weeks. So like I said, we're going to be using some of our resources that come from the CDC's website. And this was a clever little infographic that the CDC put together. It lists some of the factors that you're going to want to consider when you're running your childcare center in order to help protect children, your staff, and their families. 15 different items here, 15 different prevention strategies, and we'll discuss each of these factors in detail throughout this presentation. And the first factor, which is mentioned on the infographic, actually discusses what should happen before the children that you service even show up at your doorstep. So the first thing that you want to try to ensure, if possible, is that sick children don't come to school. You'll want to try to encourage families to monitor children at home for signs of infectious disease, including signs and symptoms of COVID-19 and other, as Colleen mentioned, other infectious diseases. So cough, fever, etc. Children and staff who do have symptoms of infectious disease should be referred to their healthcare provider for evaluation and care. But most of your children will be well. Most of the children that you service will be well, and they will be showing up to your door in the morning. And at that point, the first thing we're going to discuss is drop-off and pickup procedures. The CDC recommends that if possible, and we understand that this is not always possible, times or locations for child arrival and pickup should be staggered by cohort. So if different classes or different cohorts can be dropped off in different locations or at different times, that would of course be best. Not always practical and not always realistic. So a prevention strategy that may be a similar one, but it may be more realistic, is if drop-off and pickup can occur outdoors. That would of course be preferable if parents and other caregivers don't have to actually enter your center while they're dropping off children. Masking is also definitely one of the layered prevention strategies that we like to encourage. But since masking was mentioned in detail during the first part of this series, we won't go into further detail here. The one thing that I do want to say, and we all know this, is that the governor has announced that mask mandates will end on March 7th. So the Department of Health is working on updating guidance. More information will be forthcoming, but masking certainly continues to be an important part of layered protection. So our guidance goes into detail, and when I say our guidance, I mean the Department of Health's guidance, goes into detail about communication between childcare centers and families. And the CDC mentions it as an important factor in the reduction of COVID-19 transmission as well. This slide and the next slide comes from the Department of Health's guidance. I'll paraphrase it for you. I think the most important point is to remember is to be as proactive as possible when it comes to communication with your families, with other public health partners. You're going to want to let your families know about your center's policies before there is a case. They should know when to keep their children home from school. They should know how to contact you if they have any concerns. They should know how to be in touch with you if they have to let you know that their child is either symptomatic or even that their child has a confirmed case of COVID-19. And likewise, you'll want to let families know what your plans are for communication in the event of an outbreak. You'll want to have an emergency communication plan so that you can contact families easily and efficiently if necessary. You'll also want to be aware of how to contact your local health department, both during business hours and on the weekends or in the evenings. There may be times when you need to notify them of the case during those outside of business hour timeframes. Or you may come across a complex situation and you need them to help you make decisions, which is what they do best. So you really need to know how to contact them whenever necessary. Many of you, I'm sure, already do know how to contact your local health department, but there may be some of you who are unaware of how to be in touch with your health department. So we wanted to just pull this up here for you. And again, this link is included in the PDF file that was dropped in the chat. This is an excellent tool. It's an interactive tool that the Office of Local Public Health has put together. What this tool does is that it allows you to enter the address of your center into this interactive tool, and information about the local health department at that address will pop up for you. So you enter your location and they'll tell you the name of the local health department that you need to be in touch with if necessary, as well as contact information for that local health department. Okay, so the next item that the CDC infographic refers to is meal times. Again, to the best extent practicable, if meals can be eaten in well-ventilated areas or even outdoors, depending on the weather, that would always be best. And of course, you want to space children out at meal times as best you can to increase the distance between them. We'll be discussing the new isolation and quarantine guidelines a little bit later in the presentation. But if you do have children at your center on days 6 through 10 of isolation or quarantine, so if you have them coming back after 5 days, then you'll want to try to keep them 6 feet apart at meal times and also during nap time, whenever possible. Speaking of nap time, also layered prevention strategy that the CDC refers to. The CDC mentions that childcare providers should ensure that mats or cribs are spaced out as much as possible, and they should have children sleep head to toe. So just, nice little tips that may help prevent transmission that you can try to work into the course of your day. Now, cleaning and disinfection, which I'm sure you've all been doing forever and certainly during the past 2 years. Obviously, when dealing with small children, their personal hygiene is not necessarily the best. So you're going to want to focus on cleaning and disinfecting. So we have a few slides here. Next few slides details how to go about cleaning and disinfecting your center. We included information from the Department of Health's childcare guidance, and we also included some nice infographics from the EPA, which we thought you may want to be able to refer to. The one thing that I'll mention is that we've received a number of questions about cleaning outdoor equipment. Outdoor equipment should undergo routine cleaning, but a real deep disinfection is not necessary for outdoor. And like we mentioned, just a few nice infographics for you to have on hand. Okay, another layered prevention strategy that the CDC recommends in this early childhood setting is physical distancing. They recommend that early childhood educators modify learning stations and in-classroom activities, use available space, and stagger schedules to have fewer children in each area as much as possible. Now, obviously, children are not going to stay 6 feet apart from one another at all times, not this age children at least. But by maximizing available space, as much as you can, the hope is that the amount of actual close contact can be somewhat minimized. If you provide more space for them, the hope is that they'll just kind of won't gravitate quite as close to each other. And cohorting is really an excellent prevention strategy. It's not the only one, as our guidance mentions, but it really is an excellent prevention strategy to both to prevent the disease from spreading, but also because it can kind of help prevent some of the grief that can happen if there is a case and there are many, many close contacts. That's obviously not as fun or preferred as if you have a smaller cohort, and then if there's a case, there can be much fewer close contacts. Our guidance document discusses cohorting. I'm just going to read straight from the document because it states it so nicely. Cohorting can be used to limit the number of children and staff who come in contact with each other, especially when it's challenging to maintain physical distancing, such as among young children. The use of cohorting can limit the spread of COVID-19 between cohorts and make it easier to identify and exclude close contacts if there is a case of COVID. However, like we said, there are many other good strategies, and while cohorting is particularly useful, we wouldn't say that it should replace other prevention strategies that you may even use within a cohort, such as masking, etc. What are cohorts? Cohorts are a group of children, whether they're grouped by classroom or even within a classroom, who remain separated from other groups throughout the day as they go about their activities. In order to cohort properly, you're really going to want to make sure to have minimal or no interaction between cohorts. And another prevention strategy, we all know this, COVID-19 is not spread as easily when you're outdoors. So especially as the weather gets better, another way to minimize the spread is to hold activities outdoors whenever possible. Again, even when activities are held outdoors, though, you shouldn't necessarily say, okay, everybody's outdoors, we can crowd them, we can throw all our cohorts together. You still want to keep cohorts apart as much as possible, and you still want to maximize the amount of available play space. But being outdoors can definitely, in addition to those other strategies, can help reduce the spread of COVID-19. Okay, we're back at our hypothetical childcare center. We've run through most of these strategies that are mentioned here. We've run through strategies A through J. Did this fairly quickly because we went through some of the simpler ones. And Victoria will continue to take us through some of the remaining strategies.
So hello, everyone. Now we're going to be talking about ventilation. So I know that in part 1, we covered ventilation extensively. So we're not going to be covering it additionally today. I do just want to point out that the New Jersey Department of Health childcare guidance does have some additional tips for ventilation if you want to look at those later. Additionally, vaccination is an important layered prevention strategy for childcare centers. All COVID-19 vaccines currently authorized in the United States are effective against COVID-19, and especially severe outcomes and hospitalization and death. So make sure to encourage staff and families to get vaccinated as soon as they can. Individuals who are up to date with their vaccinations do not have to quarantine if they are exposed to a COVID-19 case. On the other hand, if an individual is eligible for a booster and they have not yet received it and they are exposed to a COVID-19 case, then they do have to quarantine. So a good website to direct the public to is www.vaccines.gov if individuals need help finding providers who are offering pediatric vaccinations. Additionally, all individuals are encouraged to be up to date with their vaccinations. So being up to date means a person has received all recommended COVID vaccines, including the booster doses when they're eligible. So children under 12 years old are not yet eligible to receive a booster. So if they've received their primary series, they are considered to be up to date. So remember, up to date individuals do not have to quarantine if they are exposed to a COVID-19 case. For those who are eligible for a booster, the time between dose 2 and the booster dose does vary depending on what type of vaccination that individual received as their primary series. So now we do have some questions to test your knowledge on how vaccination status does affect who has to quarantine? So the poll should pop up on your screen about now, I believe. And I'm just going to read this question to you. So Medea is a teacher at Family Reunion Childcare Center. She is fully vaccinated and just received her booster yesterday. She was exposed to a positive case today. Does she have to quarantine?
Okay, Victoria, I'll give it about 5 more seconds and then we'll just stop it there.
Okay, so it looks like we're pretty much split in half here. It says 48% said yes and 52% said no. So the correct answer here is B. No, Medea does not have to quarantine because she is up to date with her vaccines. So an important thing to remember is a person is considered boosted and up to date with their vaccines right after they get that booster dose. So immediately after they receive it, they are considered boosted and up to date. So our next question here is Medea is a teacher and she is fully vaccinated, but she is not yet eligible to receive her booster dose because not enough time has passed since receiving her primary series. She was exposed to a positive case today. Does she have to quarantine?
Okay, I'll go ahead and end the poll.
Okay, it looks like 64% of you said the answer is B, and that is correct. So Medea does not have to quarantine since not enough time has passed since she received the second dose of her primary series. Everyone is considered up to date until the time that they are eligible to receive a booster. Up-to-date individuals do not have to quarantine, but they are recommended to get tested at least 5 days after they last had close contact to a COVID-19 case. Additionally, even though up-to-date individuals do not have to quarantine, they should still wear a well-fitted mask around others and symptom monitor for a full 10 days after their exposure to a COVID-19 case. So question 3, Medea, a teacher, was fully vaccinated with the Pfizer vaccine on May 1st, 2021. And she has not received her booster dose. She was exposed to a positive case today, February 16th, 2022. Does she have to quarantine?
Okay, I'll go ahead and stop the poll for now.
Okay, it looks like 78% got this one right and said A. So yes, Medea would have to quarantine because she is not up to date with her COVID-19 vaccines. And our last question for this section is Joe is 5 years old. He attends a childcare center. He was fully vaccinated with the Pfizer vaccine on November 2nd, 2021, and he has not yet received a booster dose. He was exposed to a positive case today, February 16th, 2022. Does he have to quarantine? Okay, it looks like 86% of you got this one right. You are correct. The answer is B. No, Joe does not have to quarantine. He is also not even eligible for a booster because he's only 5 years old. So information on eligibility for vaccination is rapidly changing. Childcare centers should refer to CDC's webpage on COVID-19 vaccine booster shots to determine if the exposed child or staff member is up to date with their vaccinations. As of today, everyone 12 years of age and older is eligible to receive a booster dose when they become eligible. The timeline for when an individual should get a booster dose varies based on what vaccine that individual received as their primary series. Again, the CDC webpage is a great resource to refer to ensure you are making the best decision when you're quarantining close contacts. Okay, so thank you guys so much for participating in our poll questions. We have a couple more later on in the session for you. But now we're going to go back to that CDC infographic, and it also has a point about shared objects. So if possible, minimize sharing objects within the childcare center. Make sure to keep each child's belongings separated, including their mask. Additionally, if the objects are shared regularly, make sure that they are cleaned often. This slide has some hand washing tips on it, and it's from our New Jersey Department of Health Childcare Guidance. So if you want more information on this, please feel free to visit that guidance document after this training. Additionally, CDC outlines some key times when staff and children should wash their hands as specified on this slide. So remember, using the proper hand washing techniques can be fun in childcare centers. You can Google hand washing theme songs to incorporate in your childcare center that encourage hand washing for the recommended 20-second time frame. This song on your slide right now is to the tune of Row, Row, Row Your Boat. And though I'm not going to be singing it for you today, songs like this will make hand washing a routine that kids in the childcare center can look forward to. Okay. So that was some of the key things you can do to protect your childcare center. So we have went through A through N, and now the last thing we need to understand to protect your childcare center is about isolation of sick children. So this is a great infographic from the CDC that explains what to do when there are sick children in the childcare center. We're going to describe these steps in detail momentarily, but this is a great resource for you to print out and to have on hand. Okay, so when determining if an individual should isolate, it's first important to understand COVID-19 exclusion criteria. So when I say COVID-19 exclusion criteria, I'm referring to the symptoms that are on this slide. It's basically a list of COVID-19 compatible symptoms that let us know when an individual should be excluded from the childcare center. So first and foremost, parents should not send kids to the childcare center when they are sick. New Jersey Department of Health recommends that children or staff with these symptoms be promptly isolated from others and excluded from the childcare center. It's a good idea to always have this exclusion criteria close by to determine if the child or staff member should be present at the center. Remember, if the child or staff member has at least 2 of the following symptoms that you see here on the slide on the first bullet point, they should be immediately isolated and excluded from the center. Or if they have at least 1 of the following symptoms from the second bullet point, they should also be immediately isolated and excluded from the center. So we do often get the question, well, what if the child has symptoms that are really common, like the cough, and they have it all the time? So our New Jersey Department of Health guidance clarifies that individuals only need to be sent home if they have new symptoms or symptoms that are worse than baseline. So therefore, if a child is diagnosed with a chronic illness that makes them cough on a regular basis, that child would not need to be excluded unless the cough worsened or progressed from baseline. So it's important to note if a child meets COVID-19 exclusion criteria based on their symptoms, that does not necessarily mean that they for sure have COVID-19. So for quarantining purposes, we only quarantine close contacts of true COVID-19 cases. So once a child's symptoms meet the COVID-19 exclusion criteria, the childcare starts the process to determine if the child is actually a COVID-19 case. So first and foremost, the sick child should be isolated in a designated isolation room. Second, it's important the Child Care Center allocates PPE for the staff who will be monitoring the sick child. The staff assigned to supervise the children waiting to be picked up should follow physical distancing guidelines. Parents need to be notified that the child meets COVID-19 exclusion criteria and should be picked up from the center. Additionally, the center should make sure that the symptomatic individual does not have household members who are also within the center. If the symptomatic child does have a household member attending the center, that household member may also have to be excluded. When the symptomatic individual is sent home, make sure they are aware of the time frame that they need to be excluded from the child care center. After the symptomatic individual is sent home, the area where the sick child or staff member was within the last 24 hours should be cleaned and disinfected. And lastly, remember, close contacts do not have to be quarantined for all symptomatic individuals. Only close contacts of individuals with true COVID-19 need to quarantine. So as I mentioned, not every child or staff member who has COVID-compatible symptoms is a COVID case. So how do we determine which individuals should be treated as cases for the purposes of isolation and quarantine? We're going to discuss this in greater detail over the next few slides, but here's a good overview of some of the additional information that we need to gather in order to make that determination. So we do really need to ask the 4 questions that you see on this slide now to determine, should the child that meets COVID-19 exclusion criteria be isolated for COVID-19, and do their close contacts have to quarantine? Of course, you can always consult with your local health department as well, so they can help you to make this determination on whether or not the individual that meets COVID-19 exclusion criteria should follow COVID-19 isolation guidelines. So the very first question we are going to ask is, has the symptomatic individual who meets COVID-19 exclusion criteria been in close contact with a diagnosed COVID-19 case in the 5 days prior to their symptom onset? If the answer is yes, then this individual is considered to be a probable case of COVID-19. A probable case occurs when a symptomatic person has COVID-compatible symptoms as defined by the COVID-19 exclusion criteria, in addition to exposure to a positive case in the last 5 days before their symptom onset. And this exposure to a positive case is something epidemiologists like to call epi-linkage. So once you know that you do have a probable case, it's important to know that close contacts of probable cases do have to quarantine. So the next thing to consider is, has the child who meets COVID-19 exclusion criteria been tested for COVID-19? If the answer to that question is yes, and they test positive, then obviously we consider them a COVID-19 case. That symptomatic person should follow COVID-19 isolation guidelines, and their close contacts do need to quarantine. If the symptomatic case has tested and the result is negative, then in most situations, the child can follow the New Jersey Department of Health non-COVID school exclusion list to determine when that symptomatic child can come back to the child care center, and their close contacts would not have to quarantine. The only reason this would not occur is if there has been an exposure to a COVID-19 case in the past 5 days prior to their symptom onset, in addition to that negative test. So even if they have a negative test, but they've had exposure to a positive case as well, then you should reach out to your local health department to see if there's any additional steps that you should take. Additionally, we also want to ask, has the child been diagnosed with an alternative diagnosis by a healthcare provider? So if the individual that meets COVID-19 exclusion criteria never tests for COVID and has not had close contact with a COVID-19 case in the last 5 days prior to their symptom onset, and they go to be evaluated by a healthcare provider and they receive an alternative diagnosis like the flu, then their close contacts do not need to quarantine, and the symptomatic child can follow the New Jersey Department of Health non-COVID school exclusion list as far as when that symptomatic child can return to the child care center. Additionally, our last question here is, if the child who meets COVID-19 exclusion criteria, we want to know if they've been tested positive for COVID-19 in the past 90 days. So if they have tested positive for COVID-19 in the past 90 days, and that child has not had close contact with a COVID-19 case in the last 5 days, then that symptomatic individual can follow the New Jersey Department of Health non-COVID exclusion list, and their close contacts do not need to quarantine. But if for some reason they did have COVID in the last 90 days, and now they have had additional close contact to a confirmed case in the last 5 days, and they're symptomatic and they meet the COVID-19 exclusion criteria, then consult with your LHD to determine what steps you should take next. So this slide that you see on your screen now is applicable when the community transmission is in moderate, high, or very high. So this is going to be applicable to all childcare centers as of today, because we don't currently have any regions of the state that are in low community transmission just yet. So when we have moderate, high, or very high transmission, if the child who meets COVID-19 exclusion criteria never tests, they never see a doctor, and they do not have any known close contact to a COVID-19 case, then that child should follow COVID-19 isolation guidelines, but the close contacts would not need to be quarantined. So this is going to be different when we get to periods of low community transmission, because then when we have ill individuals who have COVID-19 compatible symptoms, if they have not tested and they don't have any exposure to a COVID-19 case, then they can follow the New Jersey Department of Health non-COVID school exclusion list instead of the COVID-19 isolation timeframes to determine when they can return to the childcare center. Additionally, I just wanted to put a reminder on this slide that for people who tested positive for COVID-19 in the last 90 days, if they are re-exposed to COVID, they do not have to quarantine at that point, even if they are not up to date with their vaccinations. So just to summarize, the questions on this slide help us to determine if there is COVID-19 present in the childcare center. Asking these questions helps us to determine whether isolation or quarantine should occur. So just to remind you, those questions are: has the sick child been in close contact to a COVID-19 case in the last 5 days prior to their symptom onset? Has the child been tested for COVID? Does the child have an alternative diagnosis? Has the child tested positive for COVID in the last 90 days? So after you ask those questions and we know whether they need to isolate for COVID or quarantine, we need to know what isolation and quarantine actually means, right? So Stacy from the DISH team is now going to further explain what isolation and quarantine means.
Thank you, Victoria. Hi, everybody. So I wanted to talk about this infographic here. It's from the New Jersey Department of Health, and it does explain the difference between isolation and quarantine. Isolation is for those who have COVID, and quarantine is for those who have been exposed to COVID. And here are 2 more resources for exclusion timeframes of children and staff. On the left is the New Jersey Department of Health childcare guidance for COVID-related exclusions, and on the right is the non-COVID school exclusion list for other communicable diseases. And these resources help childcares and parents know how long children should be out when they are sick. This box discusses what to do if you are COVID positive or if we suspect a person has COVID-19. The first day of symptoms or the date of the positive test is considered day 0. And then counting from there, isolation should last for 5 days after day 0. On day 6, you may leave isolation if you are fever-free without fever-reducing medications and your other symptoms are improving, but you must continue to mask in public and at home for an additional 5 days. You can return to normal activities on day 11, and then if you cannot mask correctly and consistently on days 6 through 10, you should remain in isolation through day 10, which can often happen with younger children. If you're asymptomatic when you test, but then become symptomatic, your 5-day isolation would restart, and the first day of symptoms is now considered day 0. So identifying close contacts can be particularly difficult in childcare centers and other early childhood settings because young children often have a hard time adhering to social distancing guidelines. Whether or not reliable contact tracing can be performed should be determined on a case-by-case basis, depending on the structure of your childcare center and the behaviors of the children that attend. There may be situations in which the entire cohort should be excluded because often every student within the class has been less than 6 feet away from that positive case for greater than 15 minutes within 24 hours. For that reason, small group cohorts can be particularly useful in the early childhood settings. It's also important to note that people who are exposed to COVID-19 case on days 6 through 10 after the case became symptomatic or tested positive do not have to quarantine. So this box is very similar to the one a couple slides ago, and it actually discusses quarantine guidelines. So similarly to isolation, the date of exposure to the positive case is considered day 0. Quarantine should occur through day 5, but if the person cannot mask correctly and consistently on days 6 through 10, they should remain in quarantine through day 10. Quarantine is for the unvaccinated or the partially vaccinated, including people who are eligible for a booster but haven't received one. If you're up to date on your COVID-19 vaccinations, or if you have had a confirmed case of COVID in the last 90 days, you do not have to quarantine. If anyone develops symptoms or tests positive during their quarantine timeframe, they should begin their isolation as day 0 from the positive test or symptom onset date. CDC has gathered information regarding household contacts and continuous exposure. So you'll be provided with this link in the PDF so you can refer to that CDC webpage. And this slide and the next slide discuss the recommendations for household contacts and continuous exposure. And this is additional information from the CDC website that says what to do if multiple people you live with test positive for COVID-19. You can find this information on the CDC quarantine and isolation page. Please take a few minutes. We're going to have 4 more poll questions regarding isolation and quarantine times. The first question is, Maya is a 1-year-old with a cough and a sore throat. Her dad tested positive for COVID-19 yesterday. Her parents do not want to get her tested for COVID. She lives in an area with moderate COVID-19 transmission. What exclusion timeframe does Maya use?
We'll give it 2 more seconds.
All right, so the majority, 82%, chose A, and that is the answer. Maya should isolate for the full 10 days because she's unable to mask due to her age, and she did not test. So please note, if the community was in low transmission, Maya would still be considered a probable case because of the exposure to her dad and should still follow the 10-day isolation. Question 2, related to question 1, do Maya's close contacts have to quarantine? All right, so this is pretty close, answering yes and no. And the answer is actually A, yes, because Maya has a known household exposure, which is her dad, and she is symptomatic, her close contacts will have to quarantine. So let's switch it up a little bit. And the next question is about Maya again. Maya is a 1-year-old with a cough and a sore throat, but this time she has no known COVID-19 exposure. She went to the pediatrician and tested positive for the flu. The community has moderate COVID-19 transmission. What exclusion timeframe does Maya use? Okay, so 83% answered C, and that is correct. Maya can follow the school exclusion list since she does have an alternative diagnosis from her doctor and also no exposure to COVID-19. Her close contacts also do not have to quarantine since she has no suspicion of COVID. And the last one is about Bruno. Bruno is an unvaccinated teacher at Miracle Childcare Center. He just tested positive for COVID-19. What exclusion timeframe does Bruno use? All right, so we've got some A's and B's and a little bit of E. The answer is actually B. Bruno should isolate for 5 days and he can return on day 6 with additional precautions as long as his symptoms are resolving and he is able to mask correctly and consistently on those days 6 through 10. All right, thank you for answering those poll questions. We're going to move on and talk about outbreak identification. So an outbreak in school or a childcare setting is defined as 3 or more lab-confirmed COVID-19 cases among students or staff with onsets within a 14-day period who are epidemiologically linked, do not share a household, and were not identified as close contacts of each other in another setting during standard case investigation or contact tracing. And remember, EpiLink does mean that the students and staff are in the same cohort, such as a class, bus, or lunch table. And this is an outbreak line list on the right. And an outbreak line list is filled out when a school or childcare center feels they have at least 3 of those EpiLink cases in the last 14 days without the outside exposure, known outside exposure. This list would be completed and sent to your local health department for review. And you want to add any students or staff to this list that have tested positive or are symptomatic and are in the same cohort. You can also visit the CDS education and training page to watch a how-to video from the DISH team and download a copy of this specific reporting template. And we'll provide that link to you as well. And we did receive some questions about non-COVID communicable disease reporting. So I just wanted to talk a little bit about this before we wrap up our presentation. This is the quick reference communicable disease reporting magnet. It's a literal magnet. It does list what communicable diseases are reportable and when and how they should be reported. Some diseases get reported immediately. Some are within 24 hours. Some should only be reported by phone. Some are to the local health department. Some are to New Jersey Department of Health. So this magnet just breaks it down for you. And then you can request one of these magnets from us or from your local health department if you don't have one. And you can use this magnet or the school exclusion list that we've been referencing to find information on when reporting should occur. And then again, you can also view a general outbreak training for childcare centers by the DISH team on that education and training page that I talked about. And you'll get that link in the PDF that's in the chat. Here are some resources. It's just a list of resources for testing, and they will also be in that PDF. And this is a list of childcare resources, including some grant opportunities, which will also be in the PDF. And finally, these are the resources that we referenced throughout the presentation, and of course, will be in that PDF.